Good morning, everyone. I regret to report we have 30 new cases overnight, 19 of them linked and 11 under early investigation. Only 12 of the 30 were in quarantine in their entire infectious period, and we are aware at least 14 of the 30 spent part of their infectious period in the community. We have 8 people currently hospitalised and 1 remaining in intensive care requiring ventilation. Now, today is not the first time that we have seen new daily case numbers in the 30s, and it is too early to know if this is a one-off, but it is clear that this is not a good number. While we have a high number of cases infectious in the community, our case numbers will continue to grow. Today serves as a timely reminder that every time you are out in the community and you are close to other people, there is a risk that you will become infected, whether you are vaccinated or not. COVID-safe measures like physical distancing, hand hygiene and masks are essential to protect yourself when you are outside of your home. Yesterday there were 2,866 tests, and there are a large number of new exposure sites that have been listed in the past 24 hours on the COVID-19 website. Compliance activities have been massive over the last 24 hours, a big day of compliance. ACT and New South Wales Police undertook a joint operation at 4 major border crossings between New South Wales and the ACT. 4,301 vehicles were stopped and 12 were turned around at checkpoints on the Federal Highway, Canberra Avenue, Lanyon Drive and the Monero Highway. These operations will continue into the future, and with school holidays commencing tomorrow, it is a timely reminder that you cannot travel anywhere for a holiday. You cannot leave the ACT unless you have an essential reason. WorkSafe ACT were out in force across Canberra yesterday, and alarmingly the Commissioner reported a number of significant breaches of the COVID-safe requirements on residential construction sites. These breaches are unforgivable. They have put employees and the general community at risk. It's simply not good enough, and the sites have been shut down. Yesterday, we reached 76.3% of the eligible population with their first dose and 52.3% fully vaccinated. Just over 190,000 Canberrans and people in the region have now completed their vaccination in the ACT. There are now around 50,000 first and second doses being administered in the ACT on a weekly basis across our government clinics and through our primary health network. As announced earlier in the week, there are some further minor changes to public health directions which will come into effect tomorrow. These directions will allow more people to return to work in a COVID-safe way. Local small businesses currently operating click and collect or click and delivery will now be able to have up to 5 employees on site to process orders. Motor vehicles purchased prior to the lockdown will be able to be collected in a COVID-safe way through local car dealerships. And real estate will be able to conduct pre-booked inspections for both residential and commercial properties, but with no more than 2 people. National Cabinet meets later this afternoon. There are many significant issues on the agenda. It could be a long meeting. I will provide an update on any decisions taken and their implications for the ACT at tomorrow's media conference. So in summary, for those who've joined late, a case number that's simply too high, we recorded 30 new cases overnight, 19 of them linked, only 12 in quarantine during their entire infectious period, and up to 14 infectious in the community. Dr. Coleman will provide an update on these case numbers. Minister for Health, Rachel Stephen-Smith, will provide an update, and then we're all available for questions. Thank you.
Good morning, everyone, and thank you very much, Chief Minister. So, as the Chief has outlined, with an additional 30 new COVID-19 cases notified since our last update, we now have reached 586 total cases for this outbreak. But we do continue to see people recovering, and our total number of recovered cases is now 341. This was due to 26 more recovering in the 24 hours to 8 p.m. last night. And our team continues to manage and support 245 active cases. So, of the new cases today, I can also confirm that 19 can be linked to known cases or ongoing clusters, with 15 of these household contacts. 11 remain under early investigation still. And as the Chief has identified, 12 were in quarantine during their whole infectious period and therefore no risk to the community. But we know that 14 did spend at least some time in the community for at least part of their infectious period, and 4 remain under early investigation for this parameter. We have 8 people in our hospitals, with our youngest patient being in their 30s and our oldest in their 70s. One of these is an ICU and they are being ventilated. Of the total 8, 4 are unvaccinated, 1 has received 1 dose, 2 are fully vaccinated, but neither of these 2 are in ICU, and 1 has an unknown vaccination status at this time. We have just over 780 self-identified close contacts and 320 or so active exposure locations. As always, please continue to keep up to date with the current exposure locations on our website, and if you have been to one of the identified locations, please follow our public health advice. We have no additional active public sites of transmission to add to the list today, and overnight 2 new cases have been linked to the Busy Bees Childcare Centre. But these cases are household contacts and, as we've talked about before, not unexpected. The Department of Education, Skills and Employment building in the city has now been listed as an exposure site for the 10th of September. So please, if you visited this building on the 10th, please visit the ACT COVID website for details on the classification of this site and what you need to do. Additionally, this morning, the Birch Building Facilities and Maintenance Workshop, as well as the Computer Science and Information Technology building on the ANU campus, will also be listed as exposure sites. These ones will be classified as casual sites, so if you have visited either of these, please check the website for what you need to do. And finally, today my shout out is to the teams from ACT Health and Access Canberra who answer the calls on our COVID-19 helpline. As of yesterday, these teams have actually answered over 200,000 calls since the line was established, and over 58,000 of these calls have been in the last 37 days. They can take up to 330 calls an hour. I do like chatting on the phone, but I think that is an amazing volume of calls that our members of the government are receiving. So my heartfelt thanks to you all for helping to keep Canberrans informed as we progress through this pandemic, and I'll now hand over to Minister Stephen Smith. Thank you.
Good afternoon, everyone, and thank you, Karen and Chief Minister. Today I just wanted to provide an update on how COVID-19 is affecting our disability sector and how we're supporting providers and clients. There are currently 44 cases connected to the disability sector in the ACT, and this information has been gathered during the interview process and volunteered by cases and does not necessarily indicate that cases have been a result of transmission within the sector. This includes 34 support workers and allied health therapists who may or may not have worked during their infectious period, and 10 clients who have advised that they receive care from a disability support provider. There is only one distinct cluster in this sector, which is defined as 2 or more cases that can be linked to a common exposure. This cluster currently consists of 30 cases. 13 of these are workers, including 2 New South Wales cases, and 6 people are clients of disability services. The remaining 11 cases in this cluster are a tradesperson, 1 case, and household contacts of workers that comprise 10 cases. Due to the highly contagious nature of the Delta variant, and as we've seen in the wider community, a number of household contacts becoming positive for COVID-19 was expected as a result of this cluster. I understand, and the government understands, that the current environment may be very concerning for someone. It may be very concerning for someone to have people coming into your house to provide care. I'd like to reassure those who are receiving disability support that there are a number of mitigation strategies in place to lower the risk of COVID-19 transmission, including appropriate PPE and COVID-safe practices like hand sanitizer and physical distancing where that is possible, recognising that is not always the case in providing support for people with disability. If you are a worker in this sector, a reminder to please get tested at the very first sign of symptoms and don't go into work if you are unwell. There are COVID-19 test isolation hardship payments available to make sure that people don't work while waiting for test results. Our team have been working very closely with the disability service providers and the individuals involved in every one of these cases. When a case is identified in the sector, ACT Health works closely with the Office for Disability, with the National Disability Insurance Agency and the impacted provider in order to respond quickly and appropriately. A risk assessment is undertaken to identify close and casual contacts and to rapidly activate quarantine and testing processes. A key part of this work is ensuring the immediate and ongoing care needs of clients whose support workers may need to go into quarantine. Prior to this outbreak, a lot of preparedness work has been done with the sector, including PPE training workshops, and this also includes the rapid deployment of PPE where required to disability service providers. We are absolutely committed to working through these impacts and providing support to the entire sector. And I really want to thank everyone, both disability service providers, people with disability and sector leaders, for continuing to work with us to ensure that our response is timely and appropriate. The ACT Government also continues to work with the Commonwealth and our disability sector partners to make COVID-19 vaccinations as easy and accessible as possible for people with disability. Nearly 65% of NDIS participants and almost 75% of NDIS screened staff have had at least 1 dose of vaccine. We know that some people with disability find visiting a mass vaccination clinic difficult, and so we run an access and sensory clinic 5 days a week now at the Western Creek Community Health Centre. That, as we've talked about before, provides a quieter and more accessible alternative to our mass vaccination clinic. So people who would like to avail themselves of that service are encouraged to call our booking line on 5124 777700 and select number 3 for the dedicated disability line. As today is the 17th of September, and it's the first day that mandatory vaccination has come into effect for the aged care sector, I just provide an update on vaccination rates for residential aged care as well. So 98.2% of aged care staff have had at least 1 dose of vaccine in the ACT, and 83% have had both doses of a vaccine. That is an outstanding result, and I want to thank aged care workers for coming forward and getting vaccinated, and to thank our partners and indeed the Commonwealth Government for ensuring that we have such high vaccination rates on this by the time we got to this first day of mandatory vaccination for aged care workers. Those Now, those workers who are around 50 who have not yet had a first dose of vaccine will not be able to enter their place of work from today until they receive one dose of COVID-19 vaccine. I also want to thank the unions who've worked with providers and with governments through this process, this being the first sector where mandatory vaccination has come into effect. And finally, I just want to provide an update on breast screen ACT services and let people know that breast screen ACT will reopen from Monday the 20th of September after a 5-week temporary closure due to the lockdown. Women who have had their appointments cancelled during this time will be rebooked as a priority now that services are resuming. Bookings in place next week at each of the 3 sites in Canberra City, Phillip and Belconnen will go ahead with text reminders for appointments to resume from today. All administrative staff, nurses, doctors, radiographers and sonographers at Breast Screen ACT are now fully vaccinated, which has been one of the factors in the decision to reopen. The service will restart with a comprehensive COVID-19 safety plan in place, including limits on the number of people who can be present together in particular areas within the clinics. We do understand that even with these safeguards in place, some consumers may be reluctant to continue to have their appointment at this time. So if you need to postpone your appointment or you feel that you would like to postpone your appointment, please get in touch. But I encourage anyone who does so to please continue to be breast aware and to see your GP if you identify any unusual changes. With that, I'll hand back to the Chief Minister for questions.
Thank you. Rachel, questions?
You hinted at it in your opening statement around compliance activities in the school holidays. Can we expect those heavy police presence at the border over the next 2 weeks due to the school holidays?
Yes.
Yeah. It's going to be ramped up every day.
Yes,
sort of thing?
yes. We're going to have to be all over this. Yep.
17 cases in southern New South Wales today and then this big spike today. How concerned are you about the potential pressure this poses for our ICU and hospital capacity?
Quite concerned.
And I guess, is that going to be part of today's National Cabinet talks and what's going ahead there?
Yes, hospital capacity is one of the agenda items today. It looks quite scary across Australia based on the modelling.
Are you happy for the ACT to keep accepting New South Wales patients?
We have a responsibility to do so, yes.
Chief Minister, those 4 construction sites shut down for doing the wrong thing. Do you think that'll be enough to get the message across? Is there the chance that that industry might have restrictions placed back onto it if we continue to see breaches?
I hope it is enough. I was pleased to hear the WorkSafe Commissioner report very strong compliance in another part of the city that they were focusing on, and that HIA and MBA members in particular were had very strong compliance and a good level of detail. They'd been well briefed. They understood. So I guess it's an ad for being members of the MBA and the HIA, that being involved in an industry organisation and association gives you access to quite a degree of support, just as being a member of a trade union gives you quite a degree of support, particularly when it comes to workplace safety.
And on those rules that have been relaxed for exercise, for instance, have you seen good compliance in that space, or are some people perhaps flaunting the rules a little when it comes to those outdoor activities?
It's not been drawn to my attention through all of the daily compliance updates. So we have a small number of people in a small number of areas of community life who are not doing the right thing. And unfortunately, that's one of the contributing factors to the situation we're in today.
Chief Minister, how is the ACT government supporting the mental health of our most vulnerable communities? You may have seen yesterday a study released by the ANU that showed Australians' life satisfaction is at an all-time low, but it also reported a particular increase in feelings of anxiety and fear amongst Aboriginal and Torres Strait Islander people.
Yes, I think we're all experiencing the challenges, cumulative challenges, particularly in our region, where we've had bushfires, then we seemingly had 2 weeks of sunshine when the air cleared and all the smoke cleared, and then COVID wave 1 hit. We had a small reprieve for a period, but watched other parts of the country not that far from here, go through quite difficult periods. And then through this winter, it has been incredibly challenging. That's why we've put in place a range of additional programs, provided additional support to non-government organisation partners, and why we're working with the Commonwealth on a further mental health package we hope to be able to announce some details of in the coming days.
Regarding the heavy focus on compliance at the borders, will you be, have you asked other agencies, for example, ESA, SES, ADF potentially, to help out with this in the next 2 weeks? Yep.
Yes, the Defence Force will be involved. ESA have been supporting activities, and yes, there will be boots on the ground.
And yeah, when did this come about? I mean, Defence.
It's been weeks and weeks in the planning. Associated, you might recall earlier on, we were having discussions with the New South Wales Government and the Commonwealth about how to manage the capital region. This is one of the outcomes of that engagement.
Will the ACT be closely watching this New South Wales trial of a shortened at-home quarantine?
Yes, yeah, we've been working through National Cabinet, particularly with the South Australian Government, who've got some quite clever technology that's been supporting a home quarantine trial in that state. Because we don't have direct international flights into Canberra, we've been undertaking home quarantine arrangements here for diplomats, parliamentarians, journalists, amongst others, over the last 18 months. So we're well versed in home quarantine arrangements. The issue, I guess, is expanding that to a much broader population. But I wouldn't anticipate there being direct international flights into Canberra for some time now. So the New South Wales process really will be interesting and probably applicable for ACT residents if they're coming back into the country through Sydney, that they would probably may still need to undertake hotel quarantine in Sydney, or we will need to come to some form of arrangement on transit from Sydney Airport into a home quarantine setting in the ACT in the future, but the details of that are still to be worked through.
Can we just get a brief outline of the main issues that you'll be looking to resolve at National Cabinet today?
Well, we'd all love answers to the question of what's going to happen when New South Wales open up, ease restrictions at 70% double dose. The modelling would indicate that case numbers will go from thousands into the tens of thousands each day, and sort of the peak of their epidemic will possibly hit around Christmas time. So that could be very challenging. So we'll see some of the outcomes of those decisions as they have been modelled by the Doherty Institute. We've also got on the agenda the National Health System capacity, which would appear to be insufficient for the massive number of cases that would be coming. That, of course, is contingent somewhat on decisions of other states around opening their borders. So they would be looking at this information with some trepidation around opening their borders to New South Wales, Victoria and the ACT in light of what they would be importing into their health systems. We'll also conclude, I hope, at least the first round of technical discussions in relation to the check-in apps and the ability to download your vaccination status into an app if you wanted to for the purposes of verifying vaccination status. Obviously, there'll be a different app in every state and territory. So for ACT residents, particularly those who would want to travel into New South Wales in the future, you should definitely be downloading the Services New South Wales app. And once it's possible, to be downloading your vaccination status into the Service New South Wales app, because that may be necessary for you to access certain services in New South Wales, to go into certain shops. We don't know yet exactly where they're going to draw the line, but at the moment, as I mentioned yesterday, on their essential list, you unvaccinated people could still go to a supermarket or a chemist or Bunnings, it would seem, but you may be excluded from Big W or Kmart or Target, but New South Wales will make those decisions. We might get an indication on whether this is just a transitory thing between 70 and 80% vaccination, or it will be a more permanent feature for the rest of the pandemic or the rest of time in those jurisdictions. Time will tell. We'll hopefully get some answers to some of those questions this afternoon.
And you mentioned New South Wales modelling. What's Canberra's case modelling showing?
Well, we could anticipate if we opened up at 70% case numbers in the thousands every day, and that would be an alarming figure and would overrun our health system.
You've been less reluctant than other states to mandate vaccines for certain industries, but given supply has increased in recent times, we've seen the breaches at construction sites, we've seen outbreaks at schools such as Mulcara. Are you reconsidering whether to introduce mandatory vaccines, or at least require these workers to have at least one dose by a particular date?
We've certainly been doing that in some industry sectors and some areas of government employment. We'll continue to look at those issues. One of the principles around mandating is, of course, you've got to give people the opportunity to get vaccinated, and as the question highlights, that will be less of an issue with more vaccine supply. But and again, I look at the vaccine take-up in the ACT, and we're talking about a very small number of people. I mean, the aged care situation is a very good example where we've seen very high take-up across the community more broadly. Vaccine hesitancy is not a major issue here. There's a small number of people who, for very legitimate medical reasons, can't get vaccinated, that we need to account for their circumstances. So I think, I appreciate everyone wants to know that every single person will, that they might come into contact with in a high-risk setting would be vaccinated. It is generally the case that most people are now in those settings.
I have some questions for the Chief Health Officer, unless my colleagues have any further.
Yes, sorry, I've got a few more questions for you. When will commercial landlords be able to apply for their rates relief? I know the website still says that information is coming. Why isn't that ready yet, and will it be?
Well, obviously rates are quarterly, and so we'll have information ready for this current quarter and the next quarter. So the rates bills haven't even been issued yet, so you can't get a rebate on a bill you haven't yet got. But we'll align the timing of those things for to ensure that you are able to access the rebate when the bill is issued.
But a lot of commercial landlords paid their rates bills this week for the last quarter.
That was for the last quarter, yes. The rebate applies for the 6-month period. That is the September quarter and the December quarter.
And the fitness industry has asked for specialist funding. They say that they don't have the ability, like other businesses, to obtain new customers in this time because, no click and collect services or anything. When it reopens, it's harder for customers. Customers are more hesitant to go to gyms, and also they kind of lose workers because personal trainers might think to go elsewhere.
Yeah.
Is that something being considered?
They would qualify for a range of the business assistance schemes, including, I imagine many would be eligible for the Small Business Hardship Scheme on top of the business support grants. So, look, I'll look at the coverage of that matter. If there is a particular gap, we'll have a look at that. Anything else for me? Okay, thank you. Well, I'm off to National Cabinet. I'll leave you in the hands of the Chief Health Officer and the Minister for Health. Thank you.
Thank you.
Doctor, 30 new cases today. How outside of your modelling is this, and what do you put this? If it is it substantially outside of your modelling, what do you put it down to? What's happened?
No, this isn't outside our projections or what we may expect to see. I think, as we've talked about sometimes before, being in a small jurisdiction and with smaller case numbers, there's actually quite a high degree of uncertainty, or yes, I guess uncertainty is the best way of talking about it, about what our case numbers are from day to day. So, as Chief has said, this is not an ordinary number day, but it's certainly not necessarily an indication that our trending is going up at this point in time. If you remember, only, was it last week or a little while ago, I think we had 32 cases on one day, and quite quickly we were back down to our baseline. The numbers of cases we're seeing depends on very much our testing every day. So if we're doing a lot of people who are coming to their day 7 test as part of their quarantine, or their day 2 to 3 test of an exposure site, we might expect to see a glut of cases coming through on that. So there's a number of factors around why we've seen a higher number of cases today.
I don't know if you can put a number on it, but can you say how many of these new cases could have been avoidable? Are they down to people not following the health directions, or is it simply because of close contacts in the household or the workplace?
So we've talked about the number that are due to household contacts. I think it's impossible to talk about avoidable cases now. I think as we move forward through our national plan of reopening, which goes as from phase A, which we're in now, right through to phase D, we are going to get cases, and we will just have to reach that level at which the community is comfortable, our hospital system is comfortable, our TTIQ is able to manage, and that's what we're looking for at the moment. So I think we just continue to work with all individuals who become cases and contacts, and we just try and get that number down as much as we can.
Have you got a number in mind that's something that you can accept?
I think this is something that we're working at both at a national level, as well as all the Chief Health Officers talking to their jurisdictional counterparts. It's about working out, as we've talked about before, there are public health social measures, so what kind of baseline level of restrictions we're going to need, how much public health follow-up, quarantine, contact tracing can we do, and then dependent on our vaccination coverage level. As soon as we work through that and we have a bit better understanding of that, I'll certainly be sharing it with you all and talking you through that. But this is hard. This is something we've never done before. So bear with us, and we'll bring you along when we can.
Dr. Coleman, a student at UC, has tested positive to COVID, but we haven't seen any exposure sites listed as of yet. Is that something we're likely to see today or tomorrow?
Look, my understanding is they're still working through the risk assessment on that. If there is something, it will be later this afternoon or tomorrow, but it may just be that a couple of people who are directly impacted might be directly communicated with. So that's generally what happens when it's not identified as an exposure site.
And do you have any information about whether that student is staying on campus, or have they been moved to alternate accommodation?
No, sorry, I don't have those details.
So quite a jump today, obviously. Is there a reason for that, sort of, that we can look back at a couple of weeks ago? Is it linked to any event or cluster or anything like that, or they've all just sort of come at the same time?
I think this is just part of the ebbs and flows of what we're seeing at the moment. It's very hard to link anything to a specific exposure event, except for down the track when we actually start to update you on those public exposure sites in particular. So maybe in a week we might be able to reflect back on the previous week, but I think this is just part of what we're seeing as we move forward.
And we're still seeing all these people out and about. Can you see any way forward, any sort of stricter measure or something that we could do to stop people from needing to leave the home?
It's a really difficult one, isn't it? Because I think the longer that we are in lockdown, the harder it is for people both to quarantine and isolate, but also do the right thing with the public health directions. There are some really important things that we've put in place, which includes some of the financial supports that Chief and Minister Stephen Smith were talking about, in terms of people need to be confident that if you have symptoms, if you are getting tested for COVID, or you are a case or a contact, we have the ability to support you so you don't need to go to work. I think we're also providing a whole lot of wraparound services for people who do find it more challenging or difficult to be in isolation and quarantine, and we're committed to continuing to providing those to assist people where possible. We're in this for the long haul, guys. We're going to be seeing this over several months. Even if we do get our case numbers coming right down, as we transition through our reopening, they will go back up again. So that we're just refining all those processes now.
Can you confirm whether any cases have been linked to Calvary Public Hospital in Bruce?
What do you mean by linked in terms of...
Has there been a case at the hospital? We've just heard reports of this.
It's entirely possible, but I don't have the details right at the moment. Sorry.
Some questions for the Health Minister, if my colleagues are... Minister, the Chief Minister says that we don't really have major problems with hesitancy in the ACT. There is a small portion, though, of, you talked about in aged care, of workers who won't be able to go into the workplace now because they haven't had a first dose. Do we know why these people aren't getting vaccinated?
Oh, I'm sure there could be a range of reasons, and it may actually be for some of those individuals that they weren't intending to work this week, or they just haven't quite got there yet. So I think when we're talking about a workforce of 3,000 and we've got 50 people who haven't yet had a first dose, that is a pretty remarkable result. And we'll obviously continue to work with providers, and the Commonwealth will continue to work with providers to try to get that number to 100% of workforce who've had at least one dose of vaccination. And if there do need to be any exemption requests, I think, as the Chief Minister mentioned, the medical reasons for getting an exemption from COVID-19 vaccination are extremely limited, but they're not non-existent, and so it may be possible that someone might also seek an exemption as well.
What is being done to support the Wreck Bay community in Jervis Bay? We've heard reports that the vaccination program has been slow to get to them. They're concerned, there's no public transport in and out of Wreck Bay, and a few of them don't have cars, and they're not getting the proper support. Can you just give us a run through of that?
Yeah, look, the administration of Jervis Bay Territory and Wreck Bay is often a source of confusion. That is part of the federal electorate of Fenner, which obviously is mostly in the ACT. But actually, Jervis Bay and Wreck Bay are not part of the ACT. It is a Commonwealth territory, Jervis Bay Territory, and the ACT doesn't make or administer public health directions for Jervis Bay or Wreck Bay. That is a Commonwealth responsibility. And the ACT is also not responsible for the delivery of health services in Jervis Bay or Wreck Bay. Those are delivered by the New South Wales Government under their arrangements with the Commonwealth. So really, most of the matters I think that you're talking about would be matters for the Assistant Minister for Regional Development and Territories, who's responsible for the responsible Minister for Jervis Bay, which is administered by the Department of Infrastructure, Transport, Regional Development and Communications. I do understand that there has been some inreach into Wreck Bay in terms of vaccination from New South Wales, from the correspondence that I have received in relation to that. The ACT also does provide some public health and welfare services into Wreck Bay, not specifically related to COVID-19. In particular, the ACT is responsible for delivering child protection and child welfare services in Wreck Bay. And as a result, the Community Services Directorate has, and in the Jervis Bay Territory more broadly, as a result, the Community Services Directorate does have a strong relationship with the Wreck Bay community, and on receipt of the correspondence from some individuals and traditional owners at Wreck Bay, I have asked the Community Services Directorate to have a look at what we can do to support the Wreck Bay community. But I just need to emphasise this is not formally our responsibility to provide those welfare services of the kinds that they have talked about, nor is it our responsibility to provide health services, including the vaccination program, into Jervis Bay Territory or Wreck Bay. The other thing that I would just touch on is that through our Clinical Health Emergency Coordination Centre run by Canberra Health Services, there has been a lot of work with local New South Wales health districts around how we can support people in the local region to ensure that both there is a strong response to COVID-19 outbreaks in our region, so supporting them to establish more capacity to treat and support people with COVID-19 as close to home as possible, but also how we can support them to boost their vaccination program. So I'll be having a conversation with Canberra Health Services later today to talk about whether there is more that we could do to support the Wreck Bay community, given the very strong connections between the Wreck Bay community and the Aboriginal community in the ACT. But to be very clear, that is not our responsibility. That is something we will do because we know of these strong connections, and we know that it's really important to ensure that people in our region have access to vaccination, and particularly that the Aboriginal and Torres Strait Islander community has as high a level of vaccination as possible.
You mentioned sort of 50 or so aged care workers that aren't vaccinated in the Territory, but we kind of know that the sector's already understaffed, so those 50 losses might be pretty keenly felt. What would be your advice to businesses sort of struggling to fill shifts, and would you maybe like to see the deadline for that first dose extended?
Look, people have had a long lead time to the 17th of September. That deadline has been very clear for a long period of time, and there have been multiple vaccination hubs, outreach, in-reach, to ensure that every worker in the aged care sector who wanted to and was willing to get vaccinated had the opportunity to do that. That work will not stop today. That is a very small number of people out of a workforce of 3,000, but we will continue to work with the Commonwealth and with residential aged care facilities to ensure that if those workers do want to get vaccinated, that they can have the opportunity to do that.
What does that help look like?
So there's a lot of coordination that goes on. There's a priority line for healthcare, aged care and disability support workers, where if they call, they have a priority number that they can call. If they call that number, they will get a vaccination appointment in one of our vaccination clinics as soon as possible, generally next day, appointments for those people in those priority areas. But also the Commonwealth has been working with a private provider to set up hubs across the residential aged care sector, and everyone's been working really closely together to coordinate those activities so that they meet the needs of the staff.
It looks like perhaps not an access issue then, but maybe concerns around, the vaccine itself. Would you look at doing some more education or anything like that?
Look, I think there's been a lot of effort put into that, and I think we do need to really keep this in perspective. This is a very small number of staff compared to the overall number of workers in the residential aged care sector, and for each one of those people there may be a specific reason why they either have not chosen to get vaccinated or they just haven't quite got around to it yet. Maybe they don't have a shift today, maybe they're going to get their vaccination and they've got an appointment today. So I think what we really need to do is recognise that it's been an absolutely outstanding outcome from where we were about a month ago with 44% of the workforce vaccinated to get so close to 100% by today has been a really outstanding effort, and I just really want to thank those aged care staff who have come forward and got vaccinated so that they could continue to provide the really essential support that they do to some of the most vulnerable people in our community, those who live in residential aged care facilities, where we know that if there is an outbreak of COVID-19, it can be absolutely devastating.
Minister, are you aware whether or if masks for healthcare workers are fit tested before they are worn?
Yes, so there is quite a significant fit testing program, certainly within Canberra Health Services, and that has been ramped up recently. So it's not a straightforward and simple quick process to do fit testing for masks. It does take my understanding is it can take around 45 minutes. So it's a process of testing different types of masks with a particular machine. There are now 2 machines running, if memory serves me correctly, 7 days a week from 8 a.m. to 11 p.m. At Canberra Health Services. And all of those staff who are working particularly on COVID wards, the shifts are organised so that people who are working on those wards have been fit tested. I did have some numbers yesterday, so I'll just have a quick look and see if I've still got those numbers around fit testing. Otherwise, we can come back to you in relation to that. If you've got another question, you can ask the question while I'm looking. No? Okay, no worries. Thank you.